Hello and welcome back to This Week in Global Health, otherwise known as TWiGH. TWiGH is a weekly live global health news roundup. This week we're going to be talking about human resources for health, and the reason is it is World Health Worker Day, or is World Health Worker Week. It's World Health Worker something. Somebody tell me. Chris, what's the story?
It's World Health Worker Week.
I had it as World Health Worker Day.
The acronym is WHOA.
They're so important they get an entire week.
They do get an entire week. I absolutely agree. So we're going to be talking about human resources for health, frontline healthcare workers, community healthcare workers, and actually in particular community healthcare workers. They're going to get a special place in the show tonight. If you're watching this live, please feel free to tweet us. We'll respond to your questions in the discussion section at the end of the show. If you're watching this on YouTube in the future at some point, put a comment underneath in the comment box underneath the video, and we will respond to that. We want to have some discussion. We want to hear what you think, and of course you might be listening to this on the podcast. You can get in touch with us as well, because you can get us through the email on what is our email address? hello@twig.org. Okay, and our web address is also www.twigh.org. Okay, before we'll just jump right into the show. I'm going to ask the panel to introduce themselves. We'll start off with Chris.
Hi everybody, I am Chris Ronson, coming to you from San Francisco, California. Today going to be covering a variety of topics, going a little bit in depth on World Health Worker Week, as well as a little bit of discussion about International Maternal Health and Rights Day towards the end of the show and into our discussion.
Thanks very much, Chris. And next up, Brian from Johns Hopkins.
Hi, Brian Simpson from Global Health Now here at Johns Hopkins Bloomberg School of Public Health, and I'll be talking to you about 3 stories that were in the news this week involving the environment in the U.S.
And next up, Jessica.
Hey everyone, I'm Jessica Taff, and as you can notice, I'm in a different locale today. I'm coming to you from Virginia Beach, but I'm so excited to be giving you a research update and also talking about World Healthcare Worker Week.
And from this side of the world, Katie.
The right side, right, Greg?
Exactly.
Hi everyone, my name is Katie Jackson. I'm coming to you from Stockholm, Sweden, where it actually is a bit light out right now, which I'm really happy about.
It doesn't look it, by the way. It looks like you're in the dark.
No. Well, it was.
Okay. Again, last but not least, Susan.
Hello everybody, this is Susan, and it's fantastic to be back with the entire crew this week. And yeah, I'm speaking to you from North Carolina, United States. And please don't forget, we also have an audio podcast that you can, we'll be in the show notes if you're interested to listen to us while traveling to work, traveling to school. We'll be there.
Thanks, Susan. Okay, and so we're going to start off with our usual news roundup. And Brian from Johns Hopkins, he's going to give us a news roundup from Global Health Now.
Sure. So a few stories really caught my eye this week. The first one was a report in the Associated Press yesterday about President Obama explicitly linking climate change with health issues. And I believe this is the first time that he's really stepped out on that topic, and he's really seeing that there's going to be greater risk for more pollution from the air, particulate pollution from wildfires, allergy seasons growing longer, and rising cases of insect-borne disease as well. So for the global health community, I think it was a positive step to see him actually connecting this issue with health. And one of the things they're going to be doing is partnering with Microsoft and Google. And one of the topics that caught our attention was that Microsoft is going to be developing a drone that can capture large quantities of mosquitoes that will then be digitally analyzed and sequenced, and also the pathogens that they are carrying as well will be analyzed as well.
Brian, do we have a sense of how big these drones are? I mean, I've got in my mind, I'm imagining a little mosquito-sized drone kind of whizzing after little mosquitoes and kind of...
I cannot comment on the size of those drones there. I mean, I was thinking more kind of Roomba size myself, but I don't know. It's hard to say.
Well, then you say it's a Microsoft project, but since they'll be in the air, it doesn't matter so much that they'll hang.
And I would just like to say, on behalf of anybody who's advocated for climate change and its importance and relationship with both health and ecosystems in general, and I mean this with all of my heart, thanks, Obama.
Exactly.
Finally putting a good spin on it.
And of course, we've got an episode of TWiGH on climate change and health. So if you're interested in climate change and health, go to our webpage. You can find our old episodes there, and of course, you can go to our YouTube channel, find the episode there, watch it. We've got a lot of information in there. Susan, you wanted to make a comment?
Absolutely. So I just wanted to say it's kind of landmark, the fact that Obama has mentioned that in his speech that for the first time, that how spending in health is not only going to alleviate suffering, but will also lead to increased savings for the country. And I think that's very important from a pecuniary point of view. Like, a lot of people really like talk about indirect benefits as not being that important, not being able to measure that easily, but it's a really important aspect on why we should focus on healthcare.
Okay, and on the drones issue, Jessica, before we did the show, Jessica pointed out that we could actually talk about drones for the entire episode. We could get distracted. So I'm actually going to suggest that we do an episode on drones and other kind of high-tech, gadgety stuff and the application in healthcare in developing countries. So I'm not going to say more on it. I'm going to say we're going to do that. It's coming up. Watch the space.
Okay.
Exactly.
I like it.
Any other news items, Brian?
Sure, absolutely. So the University of Alabama at Birmingham researchers have found that the chemical dispersant that was used in the BP oil spill called Corexit actually damaged human lung tissue and the gills of zebrafish and blue crabs. So it's one kind of aspect of like, oh, solving one problem but then creating another. And then so there were also a number of the workers who worked on the BP spill actually had to go to the hospital because of respiratory problems. So it's like you think one thing is solved, but it's actually creating another problem.
Yeah, absolutely.
Yeah.
Okay.
And then one last one. The Washington Post and New York Times in their Sunday papers did major stories on the drought in California, and this follows after Governor Jerry Brown instituted a mandatory 25% reduction in water usage. So it's really seeming like it's like in terms of climate change, for California at least, it's the new normal in terms of a hotter, drier climate is happening right now.
Wow. Okay. Thanks very much, Brian.
Sure.
And as always, we encourage people to sign up for Global Health Now. It's a fantastic newsletter. It comes out every weekday. We at TWiGH use it all the time. It's absolutely fantastic. Brian, as always, thanks very much. We appreciate your input.
Great. Thanks so much. See you later next time.
Take care.
Bye,
All
Brian.
good, Brian.
Okay.
Bye.
Bye-bye.
So I wanted to say also that the Global Health Now is now on Twitter, so you can follow them.
We are.
Thank you for that mention.
Welcome to Twitterverse.
Oh, and
Yay.
the webpage. They've got a great webpage. We love it.
That's right.
Yeah,
globalhealthnow.org and at GHN_news. So check us out online.
Good stuff. Thanks, Brian.
Thanks.
Okay, next up, Jessica. Jessica is going to give us our science update. Jessica, over to you.
Okie doke. Well, this week I came across a really interesting, super interesting, and I will explain to you guys why. So basically there was this paper that was published in Lancet HIV in which a cross-sectional analysis on the HIV care continuum was done in regarding Rwanda's national program there. So you guys are probably wondering, why is looking at the HIV care continuum, or otherwise known as a treatment cascade, important? Now, when I talk about the treatment cascade, this means looking at the numbers of people that are eligible for HIV therapy, those people that are eligible that are on it, those that stay on it, and those that are viral suppressed. So you see it's an important cascade. Well, this is important because in order to reduce the number of deaths from HIV each year and also new infections, it's very important to get and maintain people on care. Viral suppression is a really good indicator that therapy is working and that these people are therefore then less likely to transmit HIV to others. So that's why it's important, and also because UNAIDS has fast-track targets that center around these similar indicators. So this study looked at what was going on in Rwanda in their national program, and they found that out of 205,000 individuals that are HIV positive in the country in 2013, 90% of them are linked to care, 86% of them are retained in care, 67% of these people are eligible for antiretroviral therapy, and 63% of them are actually on care. 52% of these people are viral suppressed in the end. And let me just say, these numbers are really impressive because in the US, only 40,000 of HIV diagnosed individuals are engaged in care, with 37% of them on antiretroviral therapy, and then only 30% virally suppressed. So Rwanda definitely has us beat in this. So I just have to say, go Rwanda. That's fantastic numbers. Congratulations.
Yeah.
Absolutely. And Rwanda's actually done really well on a number of fronts in terms of really revolutionizing their public health services and their healthcare system. So, like, well done, thumbs up, fantastic to Rwanda. Very, very impressive. I was going to make the same point as you, is that those figures are actually better than the figures in the US. Mm-hmm. And of course, we know that one of the best ways to prevent the spread of HIV is to get people on treatment, because when people are on treatment, their viral load gets pushed down, and they're much less likely to pass the disease on to other people. Chris, you had a comment.
Oh, I did. I was just going to say, I know that in past shows we've actually recognized a lot of the progress that Rwanda has made with their health systems, especially when we were talking about the amount of people who went through their HPV prevention program and got the vaccines. And just that they've really been an outstanding example, especially considering that yesterday was the 21-year anniversary of the start of the Rwandan genocide. So you look at just the obstacles they've overcome and the amazing things that they've accomplished in the meantime as far as the health of their people, and it's just another reason to congratulate them and to really support all of the amazing things that they're doing.
Yep, they've come a long way in 21 years. Katie, you had a comment?
I just wanted to say that's a really good comment that you made, Chris, that and the fact that it highlights the difference between the U.S. and Rwanda. I really think that it's coming. There's a new phase coming where healthcare is now leveling across countries, and so I think it's really something to show the difference between what we would consider a developed country and developing. And I feel like I'm just speaking about Hans Rosling right now, but I like that there are such advances in countries that you wouldn't think so, which means that the community health workers and the ground up programs are doing the work they're supposed to.
Absolutely.
Yeah. More science update. Jessica, is there more?
Oh, no, I think we're actually going to do that in the discussion. Weren't we, Jessica? You found like 2 really wonderful related articles to that?
This is true. Well, not so much related to the HIV, but for those people that are interested in hearing about some new innovative therapy for infant bacterial infections, tune in because I will tell you about it.
Yeah.
Okay,
it's a teaser.
And so just so that the people watching know, when the show ends on YouTube, actually there's a longer show that we continue on and have a discussion at the end of the show, so people watching live actually get more out of this. So what am I saying? Watch live every Wednesday night, 7 o'clock. That's GMT, 2 p.m. Eastern Time. Okay. Chris, talk to us about World Healthcare Worker Week, /Day, /week.
So it is World Health Worker Week. See, now you're screwing me up. This is the 3rd year it's been done, and it was put on by the Global Health Workforce Alliance, the Frontline Health Worker Coalition, and the Health Workforce Advocacy Initiative. This entire week is really an opportunity to mobilize communities, partners, and policymakers in support of health workers in communities here locally, wherever you are, as well as around the world. So it's a much-needed opportunity for all of us to really recognize and celebrate the work that community health workers and frontline health workers do and raise awareness on the challenges that they face every day. It's also an opportunity to fill in the gaps in the health workforce. And this is, where we call on politicians, policymakers, heads of state, everyone, to help ensure that health workers have the training, the supplies, the resources, and the support that they need to effectively do their job, because they reach so many people, and what they do is very, very important and integral to a unified health system and to a functional health system.
Yeah, thanks very much, Chris. Just to give a little bit of context, we're going to be using terms like community healthcare workers and frontline healthcare workers, and just to put some definitions around those things, a community healthcare worker is somebody that's from the community that they service, right? So they've chosen by the community, they represent the community, they represent the health service in the community. They're not necessarily a healthcare professional, so they're not necessarily a doctor or a nurse. And then we've got frontline healthcare workers, which are healthcare professionals. They'll be nurses, doctors, pharmacists, and these are the people that are in the clinics, and they're usually the first port of call, the first point of contact that the community have with the formal healthcare system. Okay, over to Katie Jackson. Will you talk to us about frontline healthcare workers?
I definitely can. So community and frontline health workers directly provide services where they're most needed, especially in remote and rural areas. They're the first and often the only link to healthcare for millions of people around the world, and are capable of providing many life-saving interventions. MCSP, which is the USAID's flagship maternal and child survival program, call these health workers, community health workers, and frontline the Swiss Army knives of health systems. So really, they're the ones that are doing the work on the ground.
Katie, that spells it out really nicely, the Swiss Army knives, and it highlights the fact that, these community health workers and frontline healthcare workers serve as trusted resources of information for preventing, treatment, and managing a variety of diseases such as diarrhea, pneumonia, malaria, and also dealing with stigma or fear of diseases, especially in times of epidemics, such as what we saw in Western Africa. These frontline healthcare workers fill an incredible need. They provide immunizations, treat infections, and obviously, battling deadly diseases.
Yeah, Sulzan actually summed that up really, really well. There's this broad spectrum of the things they do. And I think in terms of recognizing the risk involved, so we look at, what's been going on in the Middle East as far as like polio vaccinations and community health workers and frontline health workers coming under attack in Pakistan, as well as the Ebola epidemic. And one organization that I came across that I thought was really cool is one called the Ebola Survivor Corps. It's ebolasurvivorcorps.org. And it's a group, it's Dr. Sarah Page and a group of doctors and specialists and scientists who wanted to make an impact and be able to help with the Ebola epidemic, but obviously didn't have a way to get there or an organization to go through. So they started the Ebola Survivor Corps in an effort to identify survivors of Ebola. Research shows that they're immune to Ebola for up to 10 years, and it makes them ideal first responders. So then they give them intensive training in Ebola response. They set them up with responder kits, which includes, all of the physical and, all of physical materials in the training, and then they establish a direct link between survivors and access to advanced care and treatment. So they're really helping to facilitate getting people who have survived the virus back into the workforce and really being those community health workers or even frontline care. So it's a great initiative, and I will put some notes about it in the show notes.
That's really nice, Chris, because when you look at the facts, almost 900 healthcare workers had contracted Ebola in Guinea, Liberia, and Sierra Leone since the epidemic began. And it's really important that the survivors from those healthcare workers can go back to the community, help in dissemination of information, social mobilization, and also like this whole stigma about being an Ebola survivor. So actually integrating those people into being, doing mobilization of information and being healthcare workers, I think that's integral to assimilating survivors in the society as well. So
very much so.
Sulzan. Yeah. Thanks, Sulzan. Thanks, Chris, and of course Katie for that news item. Next up, Jessica is going to talk to us about the 1 Million Healthcare Worker campaign. Over to Jessica.
Okay, so the 1 Million Healthcare Workers campaign is a campaign that was launched in 2013, and it has a partnership base of over 150 organizations from the United Nations, the various agencies there, civil society, the private sector, and also academia. And what this campaign does is it actively supports African governments and the partners that are working with the governments to increase the number of and the quality of lay health workers in the region. So it's not just the, of course, more is good, but even more important is, having good quality, a lot of good quality of very well-trained health workers in the region. And another thing that they're working towards is universal health care. So that's an important issue that they're covering as well.
Yeah, and the way that they're going to do this is by accelerating the attainment of universal health coverage in rural sub-Saharan Africa and providing equity-driven community health workers system scale up. They're advocating for the recognition of community health workers as a formal cadre of health workers and providing technical assistance to governments who are seeking to enhance and scale up nationally recognized community health worker programs.
What I really liked about this 1 Million Healthcare Workers campaign is that they're also urging countries to increase mobilization of their own resources towards training and supporting community health workers. I think that's really important in terms of building capacity within the country.
So. Very much so.
Okay. Well, thanks, team. What we're going to do is, when we go into the discussion part of the show, we're going to get into talking a little bit about maternal health and rights. Is it day or week? Is it
that is just a day.
That's just a day?
And it's actually on April 11th. So it's not today.
So we're going to talk about that in the discussion section of the show that's coming right up if you're watching live. As we end the show, we're just going to quickly have Katie's career corner. So she's just going to highlight some job opportunities, et cetera, et cetera. Katie, over to you.
Yeah, so Katie's Career Corner today, I tried to focus a little bit on the topic. So we have Monitoring and an Evaluation Regional Officer in Namibia with John Snow, Inc. The Regional M&E Officer will lead efforts to advocate for data review and data use at district and regional levels. They will work collaboratively with other team members on project planning and implementation. Qualifications that they're asking for is a bachelor's degree in health science, social science, population studies, or a related field, minimum of 2 years experience in monitoring and evaluation of health programs, and experience in data analysis and use of data software such as Excel, SPSS, and Stata. Just an idea to think about people that are working on the ground. John Snow Inc. also has an internship position in Boston for a web specialist. And the last one, PATH, has a program assistant in the maternal and child health and nutrition. The requirements are a bachelor's degree plus 2 years of directly related experience in a professional office environment, very administrative and program assistant based. And PATH is an international organization that drives transformative innovation to save lives and improve health, especially among women and children. So those are the 3 highlighted jobs in Katie's Career Corner today.
Thanks very much, Katie, for Katie's Career Corner. And we have that every week, by the way. So if you're looking for work in the global health space, you've got to watch all of our shows. We'll keep you up to speed. Right. That's all.
And also for other employers, sorry, just to mention, I pull these on my own. So any employers out there that would like to have their jobs advertised, please use the hashtag TWiGH. I will catch it. I've even come up with a Katie's Career Corner hashtag because apparently I want to make really long and complicated hashtags, and then we'll advertise it on the show.
And of course, you can also email those to hello@twig.org, and we'll get them. And if you've got a job that you'd like advertised, we'll do that for you with pleasure. Okay, that's all for the show, except if you're watching live, don't go away. We're going to be talking about we're going to answer questions that came over Twitter. We're going to have some discussion about maternal health, and what is it? It's Maternal Health and Rights Day. So from us, thanks for watching. Same time, same place next week. See you then. Bye.